Mechanics of the ankle and foot. Structure of the ankle. The ankle region includes the distal tibiofibular, tibiotalar, and fibulotalar joints. Tibiotalar joint is a hinge joint where the convex surface of the superior talus articulates with the concave surface of the distal tibia. It is considered to be the ankle joint. The bony structure of the ankle. Movement at the ankle joint. Dorsiflexion at the ankle is facilitated by the tibialis anterior, extensor digitorum longus, peroneus tertius, and extensor hallucis longus muscles. These are the dorsiflexors muscles. Plantar flexion at the ankle is facilitated by the gastrocnemius, soleus, which are assisted by the tibialis posterior, plantaris, peroneus longus, flexor hallucis longus, peroneus brevis, flexor digitorum longus muscles. These are the plantar flexors muscles. Subtalar joint. The anterior and posterior facet of the talus articulate with the sustentaculum tali on the superior calcaneus. 4 talocalcaneal ligaments join the talus and the calcaneus. The joint is essentially uniaxial with an alignment slightly oblique to the conventional descriptive planes of motion. Tarsometatarsal and intermetatarsal joint. These are the non-axial joints that permit only gliding movement. These joints enable the foot to function as a semi-rigid unit or to adapt flexibly to uneven surfaces during weight bearing. Metatarsophalangeal and interphalangeal joint. These are the condylite and hinge joints respectively. Numerous ligaments provide reinforcement for these joints. The toe function to smooth the weight shift to be the opposite foot during walking and help maintain stability during weight bearing by pressing against the ground when necessary. The first digit is referred to as the hallux or great toe. Plantar arches. The tarsal and metatarsal bones of the foot form 3 arches. The medial and lateral longitudinal arches stretch from the calcaneus to the metatarsal and the tarsal, while the transverse arch is formed by the basis of the metatarsal bones. Several ligaments and the plantar fascia support the plantar arches. First, the spring ligament is the primary supporter of the medial longitudinal arch, stretching from the sustentaculum tali on the calcaneus to the inferior navicular. The second, the long plantar ligament, provides the major support for the lateral longitudinal arch with assistance from the shorter plantar ligament. Plantar fascia. It is a thick band of fascia that cover the plantar aspect of the foot. As the arches deform during weight bearing, mechanical energy is stored in the stretched tendons, ligaments, and plantar fascia. Additional energy is stored in the gastrocnemius and soleus muscle as they develop eccentric tension. During the push-off phase, the stored energy in all these elastic structures is released, contributing to the force of push-off and actually reducing the metabolic energy cost of walking and running. These are the plantar fascia. Movements of the foot. What muscles are responsible for toe flexion and extension? In flexion, flexor digitorum longus, flexor digitorum brevis, quadratus plantae, lumbricals, and interossei are involved, while in extension, extensor hallucis longus, extensor digitorum longus, and extensor digitorum brevis are involved. Muscles are responsible for inversion and eversions are tibialis posterior, tibialis anterior, peroneus longus, peroneus brevis, which are assisted by the peroneus tertius muscles. Common injuries of the ankle and foot. These include inversion sprains, which are occurred due to stretching or rupture of the lateral ligaments. Ankle sprains usually occur on the lateral side because of the weaker ligament support than is present on the medial side. The medial ligament is very strong ligament that excessive eversion is more likely to result in a fracture of the distal fibula than in rupturing of the deltoid ligament. The ligament most commonly injured are the anterior and posterior talofibular ligament and the calcaneofibular ligament. Bracing and tapping are two prophylactic measures often used to protect the ankle from sprain during sport participation. Overuse injuries. Overuse injuries include Achilles tendinitis, plantar fasciitis, stress fractures, and dancing in point. In Achilles tendinitis involves inflammation and sometimes micro-rupturing of the tissue in the Achilles tendon, which typically accompanied by the swelling. While plantar fasciitis include repetitive stretching of the plantar fascia. It is a condition characterized by micro tears or inflammation of the plantar fascia near its attachment to the calcaneus. The symptoms are pain in the heel or an arch of the foot. This condition is the fourth most common cause of pain among runners and also occurs with some frequency among basketball players, tennis players, gymnastics, and dancers. Stress fractures. Stress fractures occur relatively frequently in the bones of the lower extremity. It occurs among runners due to training errors, forefoot striking, running on the hard surfaces such as concrete, improper foot wearing, and in alignment anomalies of the trunk or lower extremity. Dancing in point is particularly stressful to the second metatarsal because tension in the peroneus longus and tibialis posterior needed for maintaining the in-point position places the stressed second metatarsal in traction. Stress fractures among women runners, dancers, and gymnastics may be related to decreased bone mineral density secondary to oligomenorrhea. Alignment anomalies of the foot. Varus and valgus conditions are most common. It is the inward and outward lateral deviations, which occur in all of the major links of the lower extremity. Varus is a condition of inward deviation in alignment from the proximal to the distal end of the body segment, while the valgus is the condition of outward deviation in alignment from the proximal to the distal end of the body segment. Hallus valgus is a lateral deviation of the big toe, often caused by the wearing women's shoe with pointed toes, while the hallus varus is the medial deviation of the big toe. Injuries related to high and low arch structures. Arches that are higher or lower than the normal range have been found to influence lower extremity kinematics and kinetics with implication for the injury. High arch runners have been found to exhibit increased vertical loading rate with related higher incidence of ankle sprain, plantar fasciitis, iliotibial band, and fifth metatarsal stress fractures, while the low arch runner as compared to those with normal arches have been found to exhibit increased range of motion and velocity in rear foot inversion as well as increased ratio of eversion to tibial internal rotation. These kinematic alterations were found to result in increased incidence of general knee pain, patellar tendinitis, and patellar fasciitis. Thank you.